Our next guest will be celebrating Mother's Day this weekend.
Yes, and my husband's listening, so I hope he wrote down those details about the jewelry.
There you go.
Yep.
There you go. I have promised that I will at least once a day between now and the end of the week mention that Mother's Day is coming up as a public service announcement to dads and sons and brothers and all of that good stuff. Dr. Katherine Pannel joins us this morning. How are you?
I'm good. Thank you. Thank you for having me.
Good to be with you. This is May is Mental Health Awareness Month, and certainly we've talked in the past with you. That's certainly a big part of what you do as medical director at Right Track Medical Group, a DO, and also working with the Mississippi Psychiatric Association. What does this month mean in terms of awareness and recognition and advocacy for mental health issues?
So, May is Mental Health Awareness Month, and I'd like to say it's a month for heightened awareness. I want us to all be mental health aware every month of the year, but this is just a time of heightened awareness, just a time to have the conversations, break the silence, fight stigma, and, educate and promote policy to help those suffering with mental illness.
I think we've talked in the past about what, you used the word stigma just a second ago, what not too terribly long ago was something that was faux pas to talk about, right? We don't talk about this. We whisper about it in dark corners, maybe, or we just keep it to ourselves. Much of that stigma has been torn down, ripped away, and it hasn't happened accidentally. There have been a lot of people that have worked very, very hard to make that. Where are we today, from your perspective, in terms of not only being aware, but being willing to talk about mental health issues?
You're right. I think I personally saw a major shift in stigma and mental health and talking about mental health when we were in the pandemic, the COVID pandemic. I think that we talked about it more because everybody was struggling with their mental health during that time, and it's just continued to grow. I know our generation is terrible about talking about it still. I'm proud of our youth. I know you have a daughter my daughter's age, and they are so much more open about talking about mental health. They did that USC Speak Your Mind challenge, so they're doing a great job of talking about it. We still have a long way to go in the South. It's still a bless your heart kind of deal, but things are improving. We just have to keep having the conversations, make it normal, everyday conversations, because mental health is health. It's just as important as getting treatment for hypertension or diabetes. Mental health is health, and it's just as important as physical health.
What does that encompass, Katherine? When you're talking about mental health issues, it feels like it can be a pretty wide array of things.
Yeah, and we see close to 60 million people suffering from mental illness, whether that be depression, anxiety, substance use issues. 1 in 5 Americans suffer from mental illness. Our youth, it's 1 in 6, but sadly only 30% will even reach out to get treatment. And that's where we really have to normalize these conversations and make people aware that seeking treatment, it's not a weakness. It's actually a strength that you have seen, that you've got things and areas that you need to work on, and you're going to better yourself and seek treatment for it. And that's okay. It is okay not to be okay.
Medically, is substance abuse classified as a mental health issue, or is that kind of they're cousins? It's almost like an ancillary thing that goes along with somebody dealing with substance abuse.
No, substance use disorders are actually in the psychiatric DSM manual. It is considered a mental illness. It's a mental disease, and we need to treat it like that too. It's not just a choice. Like, it is an actual disease of the mind. But it is also very common to have both mental illness, like depression and anxiety, in addition to substance use disorder. It's usually a dual diagnosis. They usually go hand in hand, because when you're sad or depressed or anxious, sometimes we self-medicate with substances to feel better. And so, they do oftentimes stay together as opposed to being separate entities.
And we're talking about alcoholism and drug use and pill use, which I guess gets lumped in with drug use. But,
Sure.
But those are the most common things that we're describing, right?
That's right. And those are our poor coping skills. That's why, even at an early age, most mental illness presents before the age of 14. And we've got to really get our children more mental health aware and teach them healthy coping skills, ways to deal with their sadness and their anxiety, so that when they're presented with things like pills or alcohol, they won't turn to those to cope, and will have healthy coping mechanisms in place to deal with it.
We know that different people handle substances differently, right? There are some people who seem to be predisposed
Sure.
to alcoholism in particular. What's the difference between I had a bad day. It's been a long day at week. Let's have a cocktail and just relax versus I don't know how to handle the pressure of my job as soon as I get home. And sometimes before I get home, I've got a drink.
Yeah, that's a great question. I mean, we all deal with stress. There's no such world in which there's no stress, and so you've got to figure out ways to deal with stress every day. And a lot of that's in prevention, organization, planning. But it goes from I'm having a drink just because I had a bad day to something that you're noticing that's happening every day, that you can't get to sleep at night or you can't get through the rest of the day without having that drink. When it starts to impair relationships or job performance. When you're drinking more often than you're not, when you have to have a drink to not have symptoms of withdrawal, that's when it's gone too far. Really, when it starts impacting activities of daily living, that's when you need to step back and evaluate things and contemplate maybe getting into treatment.
We're a few years into the legality of medical marijuana in the state of Mississippi. There are lots of reasons that can be prescribed by doctors. Sometimes it's pain related. Sometimes it's lots of other reasons. Are there doctors that are prescribing medical marijuana for mental health related issues?
There are a few mental health diagnoses. I think one of them is even dementia. Sometimes patients get really agitated, and I know that is one of the indications that you can use medical marijuana to help with their agitation. It also kind of stimulates their appetite too. But there are in the laws of Mississippi, depression and anxiety do not fall under diagnoses that medical marijuana is approved to be used as a treatment for. The data and the research just isn't there for medical marijuana in the psychiatric realm. In fact, a lot of the data that we are seeing, just patients that have used it, it actually worsens mental illness. We see a lot of kids with psychotic breaks due to not medical marijuana, but marijuana. There's rebound anxiety. It's just right now the research is not there. I do encourage ongoing research for it because there may be a use for it, but right now there's not really a use for it.
Visiting with Dr. Katherine Pannel. She's the DO, medical director at Right Track Medical Group, and works legislatively with the Mississippi Psychiatric Association. Just a couple of minutes left. You said earlier that when it comes to the stigma, that young people seem to be better about talking about issues that they've got going on. What's the conversation that parents need to be having with children, whether it's 8-year-olds, 12-year-olds, 15-year-olds, and that's a pretty significant age difference there. How early do the conversations need to start, and what do those conversations look like?
The conversations are never too early to have. You do want to kind of modify how you have that conversation. Yes. A conversation with an 8-year-old is a lot different than a conversation with a 14-year-old. With an 8-year-old, you want to be the parent that notices that they've got a change in their behavior, that they're more sad, or they're having nightmares, not sleeping, not eating, and just really it's all about open conversation. And letting your children know that you're there to listen, not to judge, and that it's okay not to be okay. With our older kids, teens, you can approach them with the subject of suicide. I know a lot of parents are so hesitant because they think they're putting that idea in their kids' mind. They're not. Our kids are smart. They have a world of information in their phone. They know what it is. So just having those conversations that, hey, if you're sad or you're anxious or you don't like yourself, there's nothing that we can't get through together. I can help you get help. If I can't provide it, I can get you resources, but there's nothing too big, too bad that would ever warrant you taking your life.
We can't survive without these.
That's right.
Without our phones. We can't get past them. How much of the mental health related issues that you see in young people is a direct result of?
It's really huge. I'm glad that could be a whole nother segment. We ought to do one. It is huge. And there are a lot of positives to smartphones. It does foster some good connections with others, but there's also everything that people put out it's not real life. It's perfection, and that's just really hard for teens to understand and attain, that perfection is, or to understand that perfection is not attainable, and that what you're seeing on social media is not real life.
Yeah. It can be sometimes a dark and a scary place. Right. This is a conversation that certainly want to continue with you in the future. Thanks
Absolutely.
so much for coming in
Thank
this
you
morning.
For having me.
Dr. Katherine Pannel, She is the medical director at Right Track Medical Group, talking about mental health awareness in the month of May.